I don't want the cure to be worse than the problem itself. You can destroy a country this way by closing it down.
President Trump shocking a lot of people this week when he said he would like to see the country back open by Easter. Welcome back to RIP. With us now is Nolan Finley, the Detroit News editorial page editor, and Dr. Adam Rosh, a practitioner and teacher of emergency room physicians. We thank you both for being here. Nolan, let's begin with you and your recent column that seemed to agree with the president that it may be time to get the country back in gear despite the virus. Are you not concerned that more people might die?
Well, of course, and I think you have to be very prudent with this. But it's not just the president saying this. New York Governor Andrew Cuomo today said we need a public health strategy that complements a get back to work strategy. There is a growing concern that the damage we're doing to the economy, or could do to the economy, will have consequences every bit as grave as the virus itself. You know, I have been writing that poverty kills people too. And by keeping this economy shut down and by having so many people who are at or who are already at the bottom rung of the economy losing their jobs, we put people at risk of not being able to feed themselves, shelter themselves, not having health care to take care of themselves. We've got to figure out a way to responsibly, in a few weeks or less, responsibly reopen this economy and let people go back to work.
But Dr. Rosh, let me ask you, some people believe that this virus is not much worse than the flu.
So I think Nolan's point is valid for discussion, but it is misguided and dangerous. And the reason is because, think about this, the same people and the same ideas that have been telling us that this was just a flu, or that it is a hoax, or that we only have 10 cases in America, are the same people who are now telling us that we need to get out and leave our homes prematurely in 2 weeks. These false reassurances are only going to drive us to increased infectivity and increased mortality. There is a lot of really great data and experiences that came out of the 1918 flu, where we physically distanced and we had very similar impact on the economy. There's no doubt that the economy is going to go through a significant pullback. But when you study what happened in 1920, it was the cities that took early and aggressive action that not only limited the spread and mortality of the pandemic, but came out with a stronger economy.
Is it possible to do both? The president says, certainly in New York, the epicenter of the outbreak in this country, it may not be possible. Maybe not in Los Angeles, maybe not in Seattle, maybe not in New Orleans, but in smaller towns where the outbreak is not as great. Could we reduce then the social distancing at, say, Amarillo, and still have the people there go back to work at the same time imposing that same strict standard here, maybe in Detroit? I'm asking both of you.
And Huel, I think that's what a lot of people are asking. And I think those are the questions we have to ask. We can't stay shut down until this virus is completely eradicated. We've got to watch as it crests, as this curve flattens out. We're going to have to learn to take some risk. And, you know, I would certainly defer to the doctor on medical issues, but nobody is saying this is just like the flu anymore. Nobody's minimizing the risk. What we're saying is that we've got to weigh the economic harm we're doing and the damage that's going to do to the well-being of our population against the risk. And I think we should be assessing this. Nobody's saying throw the doors open right now. I think we should be assessing this. And as we're able, just like Governor Cuomo said, we should start seeing what pieces of our economy, where we can reopen with precautions, with social distancing, recognizing that we have to do things differently. But with all due respect, this is 2020, and 100 years have passed since the flu epidemic, and I think the doctor would concur that a lot of medical advances have been put in place over the past 100 years that prepare us better to fight this epidemic with technology and with the best medical care available.
Yeah, absolutely. But let me say this. The numbers that we have right now, unfortunately, you need to expect at the level of Little Caesars Arena, these are the number of deaths that we're going to see when this pandemic is done in Michigan. And it's hard to fathom. If you want to cut off physical distancing too early, too soon, you better add Comerica Park to that. And if we do nothing
and nobody's saying that, Doctor.
We better
nobody's
add
saying
Ford
we
Field
cut
to
off
that.
it too soon. What we're saying is that we need a plan for responsible reopening. And if you listen to Margaret Burks today talking about the sort of panic mongering you're engaged in here, we don't know yet where this is going. I do think we need to assess the situation on a regular basis. Nobody wants to go rushing out before it's safe to do so, but we are at some point going to have to figure out which pieces we can reopen, which folks can come back to work, so we have the means to continue to fight this virus. And if our economy collapses, we won't have that means.
Sure. The panic is being generated by the idea that an economic collapse is going to lead to the situations that people are describing, and there is an impact for sure. But you cannot have a plan to come out and people to come out on Easter when you have the leader of this country standing up there and telling us we cannot test people who are not being hospitalized. That is not how you take the proper steps to leave your house.
That's not an accurate statement, and you know it. What folks like Andrew Cuomo and others are saying, and you have some very responsible people, even some folks in your profession, saying, let's see what we can do and do it safely. It may not be Easter. It may be a month after Easter. But what we're doing now isn't sustainable. So along with treating the folks who are ill, we've got to figure out ways that we can reemerge safely and responsibly without putting people at risk. Might not be at that point yet.
Do you think, though, let me ask both of you, though, do you think that the United States took too long to actually do what we're doing now?
No question, right? There's no question about this. This was a tsunami coming towards us. The public health officials of this country who understand pandemics have not only been telling us that this was going to happen in January and February, they were telling us for the last 10 years that we needed to prepare for this. And when we have an entire political party, when we have an entire federal government that is standing up, diminishing and false reassurance to the people, that is the number one way that you cause this situation that we're in right now. And we could have had leadership from the beginning. We could have been transparent. We could have been honest with what was happening, and we could have started taking the appropriate measures and preparing the public for what was to come. We saw what was happening, and to continue to blame other countries for a virus that doesn't know borders is completely irresponsible.
And that all may be true. I don't know that it's very helpful at this point.
True.
I think there are places we can look to, like Washington State, who went through this earlier. They're a few weeks ahead of us, maybe a month ahead of us. I think it gives us the opportunity to watch the progression of the virus there and inform us about what we can expect and the things we can do, perhaps, to put this thing behind us as quickly as possible.
Nolan?
I'm hopeful that, excuse me, Huel, just a minute.
Go ahead.
I am hopeful that as treatments develop, and we know we have some great minds working on treatments, on equipment. Dyson, the vacuum maker, is out now with a new ventilator. They produce 15,000 of them already. We've got a lot of innovation and a lot of research going on right now. I'm very hopeful that we can beat this thing far better than we did 100 years ago when we had none of those things going on.
Well, let's hope we can, but I don't know if we can do both by Easter. That will
well, I don't
take
either, and I think
much
Easter
longer
was
time.
an
Gentlemen,
arbitrary
we thank you
day.
for your comments and your insights, and you in this with us too. We're all